What's up, everybody? Welcome back to Mad Medicine. My name is Farhan. I'm a medical student, and that's my cat in the back. What you up to? All right, that's cool. Anyways, today we're going to be talking about the top 5 entry-level medical careers for you to consider. Now, this is my opinion. This is my personal opinion. I'm just going to give you guys some facts. I'm going to give you guys some projections as far as the job markets are concerned, and I'm going to give you guys a little bit of descriptions as to what these careers entail as far as getting education and your salary and etc., etc. So we're going to talk about that today. If you guys don't know, I already made a top 5 medical careers video. In that video, I talked about the best medical careers, in my opinion. I'm gonna preface that it's my opinion, guys. The top 5 medical careers other than being a physician, because obviously I'm biased towards that, being a medical student. So I talked about that. There is a link in the description below. There's a banner, whatever. Go check that video out if you guys haven't done so already. Today, however, we're going to be talking about entry-level medical careers. What that means is that most of these medical careers do not require additional schooling or very long-term levels of schooling. You may have to take a test. You may have to do a little bit of things here or there. You may have to get a certificate. For most of them you do, it's preferred, but this doesn't mean you have to go and get a degree to be able to work in this career. In the previous video, you definitely needed some postgraduate, after bachelor's, some postgraduate degrees in order to work in those careers. So that's what we're going to be talking about today. Stay tuned to the end of the video, because I have some announcements that I want to tell you guys about, where this channel is heading, etc., etc. So with that being said, let's just dive right into it and let's talk about number 5. Alright, so number 5 on my list is a home health aide. A home health aide is someone who typically assists a patient who needs care at their house, who may not be able to do some of the things they can do on their own. Essentially, your role is taking care of that patient. You're going to help them out throughout their day-to-day life. You're going to help them achieve whatever they want to do. You may have to give them a bath, because some of these patients aren't able to ambulate themselves, aren't able to get up and take a bath themselves, so they need that sort of help and that constant care in order to function in a proper manner. So that's very, very important. It's a very important career, very important job, and there's a huge need for home health aides in America, because there's so many people who don't want to be in the hospital long term, but they want to have proper care taken for them. And that's where a home health aide comes in. So a little bit of numbers for you guys. I got my phone right here so I can give you guys some truthful data so you guys know. Now, the median annual wage for a home health aide is approximately $21,902. That is what $920, excuse me. So $21,920 is the average salary of someone who is a home health aide. Now, the education for this career is that you only need a high school diploma, which is good, and you do need some formal training on the job along with a certificate. A lot of times when you get hired, when you go into a program, they're going to provide you that formal training along with a certificate, because you need to have that training in order to take care of someone. And that is very good. It's very minimal. You don't need to go through and get a loan to get the training, okay? It's not like that. It's not a postgraduate schooling. Now, the entry-level postings currently, there are about 586 postings for jobs, which is a lot of jobs out there. And the job growth from 2014 to 2024, the projected job growth is about 38%, which is mind-baffling to me. 38%. The rest of the stuff we're going to talk about in this video isn't even close to 38%. They're like in the 14s, 15%, okay? So just know that. A home health aide is expected, the need for these people are expected to grow a lot. So that's pretty much what they do. These careers also allow you to work under a nurse and get that clinical experience. So if you guys are pre-med students, if you guys are pre-health students in general, you can do this on the side, make some money, and still get some clinical experience. So it's a very, very good, very important career. Number 4. Number 4 is a certified nursing assistant, a CNA. A CNA is someone who assists nurses. They're able to help the nurses achieve whatever they need to achieve, and you do need to get a certificate for this. You do need to have some formal training, but not in a way where you need to go to like a school for a couple years. Okay, again, this is an entry-level job. CNAs are sometimes referred to as orderlies, and they often work in nursing homes or even in hospitals. They do work there. I've seen them. I actually used to work with them when I was an undergrad, and they provide basic care for elderly patients who are bedridden. They'll take care of them. If they soil themselves, they'll be washing them and making sure the patient is comfortable and well taken care of. They'll dress and bathe the patients, and typically, this is the interesting thing, typically it's the CNAs who have the best and most patient interaction. So if you're looking for something that gives you a lot of patient interaction, the best, in my opinion, entry-level career is a CNA, because you're actually interacting with the patient. You're going to be talking to them, you're going to be getting to know them, and they're really going to be appreciative of the CNAs because they understand how much it takes to take care of a person. Okay, so they're very, very vital to medical structure, to patient care structure. Now, when it comes to the data, the median annual wage in 2015 was $25,710. That was the average amount of money that all the CNAs earned. And the only thing you need for a CNA is that you need to go through a state-approved education program. Usually, in some states, you can actually just take the exam for a CNA, and if you pass, you don't need to go through it. So, depending on the state you're in, the laws and the regulations might vary, so it's definitely something you need to look at. But you do need to get some formal training. You do need to go through a program for the most part. It's not a long program though, let me just preface that. The entry-level postings right now, there are 71,441. 71,441 job postings. That is a lot of job postings, even more than the home health aides, okay? And as far as job growth projections to 2024, it's expected to grow about 17%. 17%, it's still a rapidly growing subsect in medicine, in healthcare. So that is number 4. We are done with the top 2. We're done with the top 2 in the top 5. We're gonna go to number 3. Number 3 is patient service representative. Okay, a patient service representative is similar to a lot of reps in other industries because they're actually taking care of the patient, not in a medical sense specifically, but they're asking the patient, are you well serviced? Are you feeling like you're being well taken care of? They work directly to field any concerns or any needs that the patients may have. So if a patient feels like they're in too much pain, or a nurse isn't paying attention to them, or if a physician isn't treating them properly, a patient service representative can actually take care of those issues for the patient. You are essentially on the patient's side, which is very, very important. They may even field the complaints, they may track down medical records, and in some cases, they can explain the procedures, not in a medical sense, but just in a general basic knowledge sense, so that a patient understands what's happening. Essentially, the explanation usually is dependent on the physician who knows the most about the procedure that's going to happen. They're often also the first people that introduce the patient to a new medical procedure because they want to make sure that the patient understands what's happening. They're not going to be able to go in depth as to what is happening, but they tell them, hey, if you're about to go into a colonoscopy, do you understand? They take care of all that stuff, making sure a patient is well taken care of, and they're essentially on the patient's side, like I said. Now, when it comes to the numbers, I'm going to give you guys some flat out numbers. The median annual wage for patient service representatives in 2015 was $31,720, which is, a good chunk of change. $31,720, and the education you need for this is pretty much a high school diploma. That's it. But many employers like to have a degree. They like to see someone who is a little bit more educated. So if you have an associate's or a bachelor's, it'll definitely help you out in getting the degree. Also, this is another great thing you can do if you are a pre-med, pre-health student who wants to go into medicine, but you don't really know what to do. You don't really know how to get in, and you kind of want to do an experience that pays you a little bit so you can earn some money. A patient service representative is a great example of a stellar extracurricular activity, because you not only get patient-centered experience, but you also get to see how the medical system works. You also get to understand what is important in taking care of a patient, not just the medical side, but everything else, the holistic viewpoint of taking care of a patient, which is very, very important, very, very high yield experience that you can have. So that is number 3. So we're done with the top 3. We have 2 more to go. Okay, so let's talk about number 2. The last 2 are pretty, in my opinion, are the best experiences you can get. They're a little bit harder, that you do need a little bit of training, a little bit more of a training, and you do have to take exams for these, but honestly, it's well worth it because the experience you will get in these situations are going to be very, very meaningful. Number 2 is a pharmacy technician. A pharmacy technician is someone who works in the pharmacy in the back along with the pharmacist. You make sure that you collect the proper information for a patient. You help fill prescriptions. You can measure out medication amounts. That's really cool. You can package and label the medication. So essentially, you are working hand in hand with the medications. You are able to touch medications depending on which state you're in. Pharmacy techs, they don't typically answer any questions about medications because they don't have that understanding. The pharmacist has that knowledge. The pharmacist has a very good grasp of any adverse effects medications can have. A tech won't know that. But you are able to work with the medication and refill and fill prescriptions. And they generally are going to be working under a pharmacist. So if you want to go to pharmacy school, if you want to become a pharmacist, a lot of people actually become pharmacy techs to show pharmacy schools that they're interested in going to pharmacy schools. They're interested in becoming a pharmacist. I'm like stuttering, but that is a great experience to have, because if you can show a medical school, right, a pharmacy school, that you want to be a pharmacist, what better way than to say, hey, I worked as a tech at a pharmacy and I loved it. I loved working with the pharmacist, and it just strengthened my resolve to become a pharmacist. So this is a great clinical experience that you can have as a student, and this is also a very good paying job. When it comes to the numbers, the median annual wage in 2015 was $30,410, which is pretty good. That's the median. Keep in mind, people have higher wages, people have lower wages too, but this is the median, so it's a pretty good chunk of change for having a high school diploma. So the education requirements are a high school diploma, and usually there is a certificate requirement. You do have to go through a program to get trained, so you know how to count pills, how to handle medications, so there is no mishaps happening in the pharmacy, and patients are being taken care of in a proper and safe manner. So you do need to have some education, some training after a high school diploma. Just keep that in mind. And there is a test that you need to take for pharmacy tech for the most part. Okay, this as far as this job is concerned, there are approximately 23,522 postings in the nation, in the United States, for this job, but job growth is expected from 2014 to 2024 to be about 9%. So it is still growing. It's not growing as fast as the other ones, like I said, but it's definitely growing. The reason I put this as number 2 was because it not only gives you a good understanding of what being a pharmacist is like, but you also get to see everything outside of the hospital. You get to see how patients get their medications at a pharmacy, how a pharmacy runs, which is really important, especially if you are interested in any field in medicine. You could be wanting to go into dentistry, but understanding how a pharmacy runs is still important, because some dentists have to prescribe pain medication when patients go through painful procedures. So knowing how a pharmacy runs, knowing what goes into taking care of patients' medications is very vital, because in this day and age, every physician and several dentists are prescribing medications to make sure patients are healthy and their needs and diseases are being taken care of. So very important. Now, before I get to number one, I'm going to talk about the runner-up. Okay, this is the runner-up for number 1. I want to throw this in there as kind of a wild card because I want you guys to understand that there are still so many choices out there for entry-level medical professions that I had to narrow it down significantly. but I couldn't get this one out. I couldn't put it in my top 5, so I thought, you know what, let's put this up to the number 1 runner-up, and that is a medical secretary. A medical secretary is very important in medicine. If you guys have worked in a doctor's office, in any type of medical office, whether it's dentist or pharmacist or even physical therapist, a medical secretary, is very, very important. These people are taking care of the billings, they're taking care of patients being signed up for appointments, answering any questions patients may have. They're making sure patients are arriving on time and getting taken out of the rooms on time. Pretty much, it's a very, very important job. It's someone who makes sure that the office is running smoothly and effectively so that there is no mishaps happening. Very, very important. Now, their duties are going to range like a secretary's duties. They could be answering phone calls, but they could also be making sure patients are being checked in properly. They could be managing nurses as well. So there are so many things a medical secretary can do, especially if you're working long enough. You can move higher up really easily and become a vital and, in fact, a pivotal part of the team. Now, when it comes to the numbers, the median salary for a medical secretary is $33,040, which is pretty high. Out of all these, it's one of the highest ones. In fact, this is the highest salary. It's $33,040, and you only need a high school diploma for this job. Some people want to see some sort of certification, some sort of associate's degree. That can happen depending on where you are, but for the most part, the minimum requirement is a high school diploma, which is great. Especially if you guys are pre-meds. If you guys are pre-meds and you want to get some experience, what better experience than by running part of a clinic, by being part of running the clinic, being part of running a hospital setting or a ward, whatever it may be. That's so important. Now, when it comes to entry-level job postings, there's about 32,007 job postings in America, and the job growth is expected to be around 14%, which is decent compared to everything else. This is one of the medium ranges. Now, that is a medical secretary. That's our wild up. That's our runner-up. The number 1, guys, the number 1, entry-level medical career out there. Are you ready? Are you ready? I think you guys are ready. The number 1 entry-level medical career out there, in my opinion, is a medical assistant, an MA. MAs are so important. There's now becoming a very vital part of the healthcare system, of the healthcare situation that's happening in America. They're so integral to taking care of patients in outpatient settings, as in a hospital, not a hospital, but also in hospitals. They're very important in hospitals as well. So medical assistants are able to do a lot of the administrative work for physicians. They're actually able to see patients and ask patients some medical questions. They're able to scribe, which means they're able to take notes for the physician while the physician is taking the information from patients and seeing a patient. They're even able to get some vitals on patients, right? Which is really good. So essentially, you're able to do a lot of the stuff that a physician needs to do, which makes everyone's life easier, because if you can take away a little bit of that busy work from the physician can then effectively take care of the patient even faster, even easier. Same thing with a nurse. A nurse can take care of that patient even faster, even better. Now, a medical assistant also may do a lot of the works for the medical secretary. It kind of overlaps along the way because their job description, their job expectations are very similar, except that a medical assistant is going to be mainly taking care of patients more so than a medical secretary. You are going to be able to see patients, you're going to be able to interact with them and take care of them. And if you are a pre-med student who wants to get really good clinical experience and you want to be stellar for your medical school applications, what better experience, in my opinion, than being an MA? Being an MA is phenomenal work. It's hard work, but it's a phenomenal experience that you can have. Now, when it comes to the numbers, the median annual wage for an MA in 2015 was $30,590, around $31,000 roughly. The education you needed is a post-secondary program. You do need to go through a program so you understand how to take care of a patient, how to effectively take blood pressure and temperature and the weight of a patient, essentially how to take the vitals properly. You need to make sure you understand how to document things, how to type and scribe when it comes to medical documentation. So there is some training you need. I said that earlier, that these last two these last two jobs are going to be a little bit more heavy on the training. Not so much as a secondary degree, but you definitely need to have some job training. So you definitely need to go through a certification. Now, more so certifications are becoming required or preferred. It's for sure preferred. When it comes to the entry-level job postings, there's approximately 45,330 job postings out there for medical assistants, and the job growth is expected to be 23%. 23%. That's a lot of job growth. So I think that this pretty much wraps up our top 5 entry-level medical careers that you guys can consider if you guys are considering going into medicine or healthcare profession in general. Thank you so much for watching. If you guys are new to the channel, if you guys are new to our videos, thank you for your support. Thank you for supporting us. I really appreciate it. If you guys thought this was helpful, if you guys liked it, send it to a friend who may find it helpful, and don't forget to like, comment, and subscribe to our channel because we're posting brand new videos every single day. If you guys don't know, every week we're going to be posting 3 types of videos. We're going to be posting some MCAT study videos. So if you guys are pre-med students who want to go into medical school, who are ready to study for the MCAT, we're posting review videos for the MCAT where we're teaching concepts for the MCAT. We're also posting videos for the USMLE Step 1. So if you guys are medical students and just happen to be here, go ahead and check out those videos. We're posting those regularly. And we're also going to be posting these talking head videos where we talk about so many topics about medical school every Wednesday. So check us out. We're posting every single week. Thank you so much for all your support, and I want to see you guys back here next week. Take it easy, fam.